that it's already becoming widespread, and that gives me an optimism and a sense that things are really improving. I think that people are beginning to realize that there's a common basis for so many chronic diseases, things like chronic inflammation and oxidative stress and so on. And so there's a common treatment for so many of these different conditions. In our studies, it wasn't like we found that there was one set of dietary recommendations for reversing heart disease and a different one for reversing prostate cancer or diabetes or your genes or your telomeres or other things like that. It was pretty much the same for all of these. And again, it's not just diet, but also we found that stress management, things like yoga and meditation, moderate exercise, and perhaps most important, love and support are really key elements of this. And we found that the more people change, the more they change their diet, the more that they practice their stress management and exercise and so on, the more improvement we measured at any of these measures at any age. And so it's a profoundly empowering and hopeful message for people. Well, we had to provide them evidence from years of randomized controlled trials, from demonstration projects showing that this was medically effective, and also to show that it was cost effective. We did a study with Mutual of Omaha where they found that almost 80% of the people who were told they needed to undergo bypass surgery or angioplasty or stents were able to safely avoid it by changing diet and lifestyle instead. And they saved almost $30,000 per patient in the first year. Highmark Blue Cross Blue Shield found that they cut their overall healthcare costs in half in the first year. And so with the evidence showing that on the one hand, there's really kind of a convergence of forces that's making this the right idea at the right time. On the one hand, the limitations of conventional approaches like drugs and surgery are becoming increasingly well documented. Studies are showing, for example, that randomized trials of stents and angioplasties have shown clearly in over 8 studies that in stable patients with heart disease, that stents and angioplasties really don't work. They don't prolong life, they don't prevent heart attacks, they don't even reduce angina. And the same is true for bypass surgery, except for a very small percentage of people who are stable, they don't really work either. And we spent almost $100 billion last year just on these 2 procedures that are dangerous, invasive, expensive, and largely ineffective. Studies in the New England Journal of Medicine have shown that in men with early stage prostate cancer, only about 1 out of 49 men benefits from surgery or radiation. The other 48 often get harmed in the most personal ways. They're incontinent, so they're wearing diapers. They're impotent, so they can't have sex, for no benefit at huge economic costs. Drug treatments for diabetes, getting your blood sugar down with drugs, doesn't work nearly as well as getting it down with diet and lifestyle. And so at the same time that the limitations of drugs and surgery are becoming increasingly well documented, now in a crisis, of course, they can be life-saving, but for chronic diseases, they don't work nearly as well. There's more and more evidence showing that these simple changes in diet and lifestyle can actually reverse most conditions like heart disease, diabetes, early stage prostate cancer, and so on. And then as the incentives change under the Affordable Care Act, all of these, it's kind of a perfect storm that makes this the right idea at the right time.